Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my occasionally charming but very well coiffed co-host today, Dr. J. Calvert. How are you?
I'm good. I made it to hair and makeup today,
You did.
I'm trying to look, a little less. My dad said something to me when I was visiting him recently, and it was after being with him for 5 days in Hawaii. He goes, "Have you ever thought about combing your hair?"
Oh, man.
I was like, yes, I have combed my hair, and it was very funny. We lost it. So, like the other day, I called him. I was like, "Hey, Dad, I got to talk to you about something." And he's like, "What?" And I was like, I don't want to go out on a limb here, but I'm thinking about combing my hair.
Aw.
It was like, all right, that's enough. I was like,
Well, that is a very appropriate lead-in to the fact that today we are talking about, well, not hair care. We're talking about skincare.
yes.
Which is in itself a very broad topic, but I think it's something I kind of want to just touch on because there are a few points that I want to discuss.
Skincare is big, and I know that we in plastic surgery kind of harp on it a lot because if your skin doesn't look great, then all the plastic surgery operations we do are going to be wrapped in sort of something not awesome. So you want to,
awesome.
you got to take care of your skin.
The skin is so crucial. Yes, we can do so many cool things with plastic surgery, facelifts, rhinoplasties, tummy tucks, all these things that really recontour and reshape how you look. But if the skin that's on top of the face or on top of the breasts or on top of the abdomen is not great quality, then the results are not going to be as good as they could possibly be. So even though as plastic surgeons, we don't necessarily do a lot of skin care necessarily or skin procedures, it is something that is very important to us and it's something that we do definitely pay a lot of attention to. And sort of the impetus for why I was wanting to talk about this was because I've had a couple instances recently where I have people in my office who are maybe like in their 40s, 50s, 60s, and they'll say something to the effect of, "Oh my gosh, your skin is so good. What do you do for your skin?" And I never really know how to answer that because I'm like,
where do I begin?
Exactly. I'm like, I kind of need a whole podcast to talk about this.
It's a lot.
Because it's a lot. And it's not just like one cream or like one thing you do. It is literally a systematic approach to your skin that doesn't start when you're in your 50s. It starts when you're in your teenage years. So it's a really big topic, and there's a lot of things that we could go into the weeds about that we're not. But I want to get sort of like the basics of where you need to be at each decade and what works so that you're not in your fifth decade going, what kind of creams should I start using?
Yeah, I mean, I talk a lot about skincare with people, and I usually say the best way to kind of get into it is to go to our estheticians as a starting point because they see so much variation in skin types and, skin, turgor and the texture and the thickness and they know what certain products do for your skin and they have the best shot at like assessing where you are that they can actually help you and doing a hydrofacial and all the things that, Roddy and Caitlin do, and we just have amazing esthetician folks around our places. But starting with a great assessment, because what's going to happen is everybody has like some potpourri of products in their medicine drawer or cabinet right now.
So many.
Right? That you've tried, and a lot of
I've
them
been gifted this, and I've been given that. I got a sample of this, and my mom said to try this.
And the over-the-counter stuff in general is not awesome. It's not the worst thing for you. At least you're doing something.
We'll get into what's good and what's not.
All right, yeah. But the reality is getting a great assessment of where you're starting makes a huge difference in then directing care.
Yes, absolutely. And you do not need 20 products. I mean, you can be like some of us and do like the Korean 7-step skincare every night, but you don't necessarily need all that.
Do some of us do that?
Some of us do that.
I think some of us may do that. Some of us don't. So I'm not a 7-step guy at all.
But I think
I'm a one-step
you're a
guy.
one-step. You wash your face.
I wash my face.
Yeah.
I do that.
So take notes. But what I think we need to start with is, this is going to age me, but like when I was graduating high school, class of 2000, there was a song came out and it said, class of 2000, if I could give you any advice, it would be wear sunscreen. It was like some silly song, but that was like the graduating advice to the class of 2000. And it was a song and it was like, wear sunscreen.
Well, it was actually an address by Kurt Vonnegut.
Yes.
Yeah. So he had given that he said it's the one thing that's going to like keep you looking younger.
It's wear sunscreen. But the thing is, even then, like my vain 17-year-old self didn't comprehend what that meant.
It doesn't
and it's
matter.
not until you get into your later decades that you really realize the importance of it. And so if I could stress anything now to anybody who's younger or older of any age, oh my gosh, sun protection. And it's not just sunscreen. And I'm going to talk about what you can do for the sun protection, but this is why it's important. Gosh, everyone loves to look brown and tan and glowing, and that looks great in the beginning. But what the sun does to your skin over time is incredibly damaging. And I'm not even going to talk about cancer because, yeah, it's important, but that's not why we're here. What I'm talking about is what it does to how you look. And it damages the skin. It's as bad as smoking. And smoking is awful for the skin. And both of them act in similar ways, sun damage and smoking. It kills off the blood supply. It damages the properties of the skin that allow it to be dewy and elastic. It destroys the collagen. It turns your skin into crinkled leather. And that is not something that anybody wants. It doesn't make your facelift look great when you're in your 50s.
No, I was going to say, try facelifting a leather shoe.
It's not helpful. And so it may look great when you're 18 and 24 and 25, but that sun damage will catch up to you. And I'm not even saying avoid tanning your face. I'm saying protect it like it's something precious in your life. And so that means when you wake up in the morning, you're putting on sunscreen, you're wearing moisturizer with sunscreen, you're putting on skincare products, foundations, powders, whatever that have sunscreen. But even more importantly, once you're out in the world, you're doing some kind of physical protection. So hats. I mean, if you see me, I have like the full-on visor. I look like some kind of like Star Wars character.
You do.
Because
sometimes you look like a Jawa.
I totally do. And I even now have the gloves that go up past my elbows to protect my arms when I'm driving. Because when you're driving especially here in Southern California, you just get blasted by the sun rays, 5:00 p.m. driving home on the freeway. Like, no, you don't have to go to that extreme, but you have to be cognizant of the fact that the sun does incredible damage to you. And if you do nothing else in this world, protect your skin from the sun. And I think don't smoke goes without saying for many reasons. Like a cigarette here and there is not going to be the end of the world, but chronic smoking is certainly going to do damage to the skin. So those are like at its most basic, something you have to consider when you're talking about taking care of your skin, protecting it. And then as you're going on into, your 20s and things like that, and you're getting a little more proactive about the kind of creams and devices and things you're using on your skin, there are sort of like 2 or 3 main tenets of things you probably should be doing on a regular basis, everyone. It should be like fluoride in the water. You should be using some kind of high-potent, medical-grade vitamin C product in the morning and some kind of Retin-A product in the evening. And you can start doing that in your late teens, early 20s. These are great products. They worked the vitamin C, and I'm not going to go into the details. You can look it up. But vitamin C is known to protect the skin. It protects against free radicals. It helps build collagen. Retin-A does something similar in terms of how it affects the texture and the quality and the thickness of the skin. So those 3 things you should be doing as soon as you even are thinking about skincare.
Yeah.
Vitamin C, Retin-A, and sunscreen at baseline.
Yeah, I mean, those things are really key. And you said it, the free radicals, like this is why smoking damages your skin so badly, because you're doing a couple of things. You are creating like all kinds of free radicals by smoking, and then also the carbon monoxide, which is, reducing your oxygen carrying capacity of your blood.
More free radical procreation.
Yep, absolutely. And you're not
and those
getting
free radicals are just scavengers that just destroy everything.
Yeah, they beat up cells and cause scarring, basically.
Yeah.
And it's not like a scar like you had surgery, but it's like it just makes your skin less healthy. It makes it less vascular.
supple.
It makes it less,
Soft.
It just makes it into leather.
Yeah.
And smoking is really terrible for and vaping, vaping's right there with it
Yeah.
because you're still getting the carbon
chemicals,
monoxide.
the nicotine, the decreased vascularization.
Yeah, everyone acts like vaping is going to like help them. Like it's
just as
the
bad.
same thing,
It's the
dude.
same
It's like
thing.
the same. You're still going to get carbon monoxide. You're still going to get all those issues that are going to cause all the damage that you would get with smoking. It's not any different from that standpoint. But, and like I'm sure the vapors, like be like, oh, you're wrong. You're crazy. I'm not.
No.
It's like
It's science.
Like do the math. Like you can see what's happening with this stuff. It doesn't mean you can't do it. You just have to understand what the damage is, so that you can go ahead and and sun is awful for your skin, and it has been for me. I mean, I have like poikiloderma from sun damage that's happened over the years, regardless of the fact that I still put sunblock on.
Right.
But I didn't really start that till later on because in the 80s, what did we do?
Suntanned.
No, we didn't just suntan. Like I would go over to, my girlfriend's house and she'd be like, let's lay out like after school. And we would put baby oil all over us and lay out and just get fried in the New Jersey sun that, happened for a very, very short period of time, thank God, because otherwise they would have done it all the time. But it definitely took its toll, and those things are, the sun damage is there, and it's hard to reverse, and you have to do things like lasers and all that, and which you and I both do, and that's kind of what you have to kind of think about is how are you going to, keep your skin looking great while you go through life.
While you go through life, and in the beginning, it's really about prevention. But as you're getting through your 20s, coming up late 20s, early 30s. You're going to have to kind of kick it up a little bit. And this is where things like preventative botox are really helpful. I was watching or listening or reading or some article about a patient or a lady who was shocked, floored, amazed to find out that all of her friends who were in their late 30s and 40s have been doing Botox since they were in their 20s. And she was asking them, why does your skin look so good? And they were like, well, we've been doing Botox for the past 10 years. She was like, did I miss that memo? You did.
You did.
You did. And so here's the thing with Botox. Botox works on muscles that move. And so it is not going to be for muscles for fine lines or wrinkles that are there at rest. It can soften them. But what it really does, the main activity of Botox, is it weakens or it paralyzes muscles. And when the muscles don't move, then you don't form these wrinkles or these creases in your skin, because the skin of the face is very adherent to the muscles underneath it. So every time the muscle moves, so does the skin, and it creates these creases with chronic movement. And so these are going to be the forehead creases that go across your forehead, or the lines that come in between the brows, or the crow's feet around your eyes. And so if you just don't use them that much, and then what muscles are weaker, and you start doing this at a younger age, not only does the Botox weaken your muscles, you also kind of train your body to not use those muscles as much. And so you don't get those fine lines and wrinkles. And so you can get into the later decades of your life without having the wrinkles that might have otherwise been there. And so I'm sure there's going to be all kind of trolls and haters out there that are like, you shouldn't be doing Botox that young. And the topic of this podcast is how to have beautiful skin. So these are the things that people do to have beautiful, flawless skin. And that's just part of it. And if you don't want to subscribe to it, totally fine. I have some friends who don't do Botox and they have wrinkles and fine lines and they're beautiful and they look great. And I always stare at them and I'm like, oh my gosh, so that's what aging naturally looks like. And there is a certain beauty to it that I appreciate, but it's kind of an anomaly in a lot of our world.
Well, in our world. Yeah. I mean,
but I'm not saying everyone has to do it. I'm just saying this is how you can maintain sort of that lineless look, if that's the look you are going for.
Lineless is good. Some people like to, they've earned their wrinkles. They want to just have them.
Absolutely.
That's fine.
And that's totally fine. That is, I have no problem with that as long as you're wearing sunscreen. So that is one thing that if you're really trying to be aggressive about preserving that really youthful skin look, that's something that definitely 1,000% is going to need to be in your
repertoire
of skincare techniques.
So let's go through that though. What is, the repertoire that you need to have? I'm a dude. So like for me, it's like I actually use decent products on my face to like wash my face and stuff like that. And I use a lot of the stuff that we have at Rock Spa. And, I'm not going crazy with toners and all these other things that I know that a lot of people do. And those people do have better looking skin. I will tell you, they do. Hands down, if you use all that stuff and you're going to take the time, it's great. But I think having like a decent cleanser does make a difference. And I think having, some sort of moisturizer if you need it. Some people don't need moisturizer.
Some people don't.
I love Retin-A. I think it's great. For me, I can't use it. I just get completely inflamed and my skin looks ridiculous. I can't do that.
So here's the thing with Retin-A. If you're going to start using it, make sure. So let me just go back on this because I talked about those 3 things you need, right? The sunscreen, pretty basic. Vitamin C, you really need to have, like I said, a medical grade, one that you can get either in a doctor's office. The products that are sold in derm stores or medical offices are really good, high quality. You have to be really careful with the ones that you buy in the drugstore. They may say they're vitamin C, but unless they have a certain percentage, they're not going to be adequately potent enough to actually do anything, and you're just wasting your money. A good quality vitamin C product is going to cost you at least $60, $70, $80, $100.
Yeah,
if you're getting a vitamin C product at the drugstore for $20 or $30, it's probably not that potent and not really doing anything for you. So go to the products that are sold in doctor's offices. That's where you're really going to get the bang for your buck. I love SkinCeuticals. That has a cult following. Everyone knows about CE ferulic and the different vitamin C's that the SkinCeuticals line has. No financial interest. But that's sort of the gold standard of vitamin C products. And the same thing for Retin-A's. You can get, I'm sure, a gajillion products that claim to have some version of Retin-A in them, but really it's going to be the more medical grade, prescription-based products that are going to have the appropriate amount and the adequate formation or product formulation of Retin-A. Because Retin-A goes through several degradations, and there's only a few of them that are actually potent enough to actually do anything for your skin. When I was a teenager, I had acne, so I was always on prescription Retin-A, and then I just kind of continued it into my 20s. So my skin's pretty used to prescription strength Retin-A, and it's basic and it's generic, and I get it from the pharmacy. I know my insurance doesn't pay for it anymore, but it works because it's prescription strength Retin-A. But that being said, you do have to build up a tolerance to it.
You do.
And there is going to be a phase where your skin's going to go through a red, flaky period. So you start out, once a week, and then twice a week, and then 3 times a week. Even now, I only do it every other day because I don't need to do it every day. It's the consistency that's key. So Retin-A should be potent, but your skin does need to build up a tolerance to it.
Yeah, and it works. It works great. Retin-A is amazing.
I can always tell who of my patients has been using Retin-A faithfully because their skin is just smooth. It's like baby skin. It's soft. It's beautiful. And I can always tell who's been sort of doing it routinely. And so that's the thing with the products that you're going to use. You don't need a lot. You don't need all 7 steps, but you do need at least a couple of these high-grade, medical-grade products to make a difference. And then you can, if you want to throw other things into the mix, like exfoliators, chemical exfoliators, all of those things are fine. I think any kind of product that has some kind of growth factors in them are really helpful. So there are some like I know Skin Medica has some TNF alpha, or not TNF alpha. They have like a TNF product that has growth factors in it. Just things that kind of stimulate your body and your skin to create new healthy turnover. You don't need that. I think if you can do that and you want to add the extra steps, you can. But as long as you have the basics of skincare, that's a good foundation.
Yeah, I think, you said it. The vitamin C product, a Retin-A and a sunscreen, good cleanser. I mean, these products they're expensive, but they're not crazy expensive. I mean, we have stuff at Rock Spa, in the office that are, $80, 100, 110. Nothing like some of these like over-the-counter things are
like hundreds
crazy
of dollars. And I'm like, I don't know that it's really doing
I mean, I don't want to name names, but you know who you are. But
Yeah.
some of them are like 100% BS, and they're like $500 for like some kind of cream.
Yeah, some kind of gold flaked something. Yeah,
No.
you don't need all of that.
No,
there's some basics that will do you just fine. But let's be honest, that's not enough. Like,
No.
if it was the end of story, then we'd all be walking around with beautiful glowing skin. But that's not enough, especially as you get a little bit farther along in life. And what's really going to be important, especially as you're hitting probably your 30s, is you're going to start to see the accumulation of the sun damage that happened when you were earlier. And this typically shows up as dark spots, so brown spots, age spots, sunspots, changes in texture. So the skin gets a little bit more coarser, a little less smooth. You might start to see some of those fine lines coming in. And no matter what the products tell you, they're really not going to be able to address that. There is no product out there that's going to be able to bleach away your sunspots and the brown spots. They're just not. This is where you have to get the toys. You have to get the lasers. Because if you really want to get that blemish, smooth, clear skin, you have to bring in the heavy hitters in the form of lasers. And that's just period, end of story.
That's right.
And not every skin type is going to be able to do that. Darker skin tones have to be much more careful with the kinds of lasers they use. So go to somebody who knows their laser medicine. We've talked about this before. So a dermatologist or plastic surgery office, those are the places that really know how to use these lasers, because lasers in the wrong hands, in someone who's just learned how to turn the on button at some med spa, that is not the person you want to be going to with these really potent high energy devices, especially if you have skin on the darker spectrum.
No, you want experts. You want people that can do the key is the assessment. I mean, in the end, that you have to understand what you're looking at as the practitioner, as the surgeon, the nurse practitioner, the PA, whoever it is that's taking care of you needs experience, and they need to know what they're looking at so that they can give you treatments that are actually going to make a difference and not, not do nothing, but also not cause damage.
Right.
Which can totally happen.
Oh my God, it can totally happen.
I mean, I know an esthetician in town who went to, her friend who had just gotten the new laser, and it ruined her face, and she has all kinds of crazy pigment. And she came to me. She's like, "What do I do about this?" I was like, "We're gonna have to start some Cosmo on peels. We're gonna I know what to do about it, but it would have been better to not have that at all. It was unnecessary."
Yeah, go to a doctor's office for this kind of stuff. Don't mess around and go to someone that really knows how to do it. But in the right hands, with the right devices at the right settings, these are where you're going to really see the improvements in the color, tone, and texture of your skin. And this is going to be in the form of an IPL machine, perhaps. So a machine that's designed to blast the brown and the red pigment in your skin. It's going to get rid of those freckles and those sunspots. You're also going to have some lasers that can deal with telangiectasias and broken blood vessels, the V-beams, lasers like that. That's where you're really going to see the benefit in terms of getting all of that pigment out of your skin that no over-the-counter cream or no prescription cream is really going to be able to address. You need to bring in the big guns. So doing lasers, get a package, do 3-4 at a time, kind of get the sort of foundation, and then go in and do it every 1 to 2 times a year to maintain the results. A lot of times people will come in after the summer months and blast away all the damage they did during the summer months and get that pigment out of their skin in the fall and the winter. And then I love microneedling. I think microneedling is amazing. I love microneedling with PRP, using your own blood and your serum, the classic vampire facial, or microneedling with exosomes, which I think is fantastic. So microneedling has these little tiny needles that make micro-injuries in your skin, and as your skin heals those micro-injuries, it develops and builds new collagen, and it repairs a lot of the things that have gone wrong in the skin, whether it's pigment, texture, things like that. So doing microneedling once every 3 months, have yourself set up for that. Go in and see the estheticians and get a facial once every couple of months to clear the pores out and refresh the skin and exfoliate it. These are all maintenance things that are more in-depth and more involved than just some serums and creams.
Yeah, those things really make a big difference.
Huge difference.
The microneedling, I love microneedling.
Love it
and I
so
love
much.
the microneedling with RF. I like the Potenza that we have. I think there's just so much you can do. And again, it this comes back to our whole concept of having the right successful aesthetic attitude. You want to have an approach to your aesthetic world, to your aesthetic scene, your aesthetic look that is goal-directed and focused on the results you're looking for. And if you just buy products and like, that's not going to work.
You need a plan, and going to this person because they have a special, or going to this person because your friend suggested it, is not helpful.
No, it's so not helpful.
It's so not helpful. Like, you need a plan, you need a quarterback, you need someone who's going to guide you through what your individual needs are, and have a plan so that you're not wasting money, because all of this stuff is expensive. Like, full caveat, this stuff is expensive. And not everyone can do it, or not everyone can do it to the extent they want to. So you really have to choose the things that matter to you and focus on them, and come up with a plan to make this effective and efficient and affordable for you.
Well, and the other part of that is you got to know that the person you're talking to knows what they're talking about and can get you where you want to go. Like, that's why you go to places that have been around a long time with, that's, I mean, in the rock spa, like, we've got Orla, we've got Christina, we've got these amazing PAs that have they've just been in it for so long, and they're so good at it. It's like they're not going to steer you wrong, and they don't tell you buy everything. They tell you this is what you need. This is what you should use.
Yeah.
And I'm telling you, I know not everybody's in Los Angeles, but for those that you are, I recommend them very highly. Obviously, they work for me, and I think they're amazing, or they wouldn't be there. But wherever you are in the world, find that person that can actually direct you to the right treatments, to the right products, to the right skincare approach, so that you are making progress. And if things aren't going well, then you need to go back and talk to them and say, hey, the stuff that you recommended isn't working.
Right.
I need a different approach. I need a different plan.
Yep. And all of these things that we're talking about are really for the quality of the skin. We haven't even really talked about, like, the tightening and the skin tightening devices.
So much.
There's so much that you could do, and that's not really the point. So like the microneedling with RF, like you mentioned, like the Potenza and the Morpheus, all these things are designed to theoretically tighten the skin and maybe hold off that facelift for another couple of years. Whether they do or not, that's another topic for the podcast. But just know that by having this good skin foundation, when you do start talking about needing to tighten your skin, whether that's going to be with a non-surgical machine or with a facelift, you have already set yourself up for success because your skin is ready. It's a good quality, and no matter what you do for it, whatever's in your means and your budget within your realm, you've set yourself up to have the best success possible because your skin is primed and in good strength and character.
Awesome. Nailed it. That's exactly it. You got to be ready to really be an active participant in your aesthetic plan.
Absolutely. So hopefully everyone's listening to this when, they're 18, but obviously not everyone is.
But if you're not, you still can jump in and get there.
You still can jump in.
Get the assessment. Get in.
Yes, that is key. And if you have not looked at your skin or taken care of it in decades, all is not lost. There are things that can be done to salvage the situation. But theoretically, the sooner you can start, the more preventative you can be, the better. And if I could say anything, the sun is your enemy and Botox is your friend.
I think we could quote the Aussie man and say that you need to approach the apocalypse with a very, very positive aesthetic attitude.
A can-do attitude.
That's what you need to do.
Yes. So that's it. So that's, next time someone asks, well, what do you do for your skin? I'm just going to send them the QR link
Here you go.
This podcast.
Take a listen.
Lots of skincare. So, actually, you know what? Let me just tell you real quick. This is what I do, just because that's actually what happened. In the morning, I wash my face. I use some kind of moisturizing serum. I use a topical flagell because I have rosacea, and so that's a prescription strength cream that helps with the redness.
Metrogel.
Yeah,
for your face. It's
I
good.
use a vitamin C. I use SkinCeuticals. And then I have a moisturizer with sunscreen, and then I have a tinted sunscreen on top of that. So like 2 sunscreens back to back. And that's my morning routine.
Dang.
And then in the evenings, it's face wash, another serum that has moisturizing properties, a different one than I use in the morning. And then I alternate. If it's a Retin-A day, then I use my prescription Retin-A 0.25%. Or if it's a non-Retin-A day, then I use some kind of growth factor like the Skin Medica products or some kind of exosome product. And then I have like a heavy-duty moisturizer. Oh, and neck cream. Don't forget about the neck cream. The neck and the chest area is incredibly important. So I have creams that I use for the neck and the chest.
Because it gets a
morning
lot of
and
sun
evening.
exposure
Lots of
also.
sun exposure. And then every 3 months, I'm doing some kind of microneedling with exosomes. And once a year, I will trade that out for a Morpheus treatment, so microneedling with some kind of energy RF frequency. Once a year, I'm in with Orla doing some kind of resurfacing laser to get the dead skin and the pigment and resurfacing, as well as some kind of IPL photofacial to get the brown spots. And I think that's it.
I don't know. I see you doing stuff to your face all the time. Like when I walk in and I see you with numbing cream on, I'm like, all right,
Something's happening.
what's going on?
Oh, yeah. And then, of course, like every 2-3 months, there's the Botox to keep
Yeah,
the
but
face
there's some other
expressionless.
stuff too. I see some local going in. Like, by the way, like you're your own practitioner on a lot of that stuff, which is so I cannot do the stuff to myself. I have to have somebody else do it.
I definitely do most. The only thing Orla does for me, Orla will do my my lasers. I tend to do everything else.
Yeah, that's probably a good idea.
Yeah, I don't zap my own skin.
She's the bomb.
But
She came in the other day and did my facelift patient. Like, first of all, that new laser we have is
I like it a lot. Yeah,
it's
great.
bananas. I mean, she did that in like no time flat, and it looks amazing. Like I did a full face, like facial everything yesterday, and the patient came back today, and she looked great. She wasn't even that swollen. It was like crazy.
That's great.
And I think that machine is really effective. So I think
Sometimes you need the big guns.
you definitely need the big guns.
Yeah.
And you are totally up for the big guns at almost any time. I've seen that.
Yes, it's important. That's the caveat. If this is important to you,
You'll do it.
those are the steps. And I think that's it. That's my little rundown. So this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.